think we'll be live in 10 seconds.
Yeah, I think we are.
No, it is still preparing. Yeah, so I think welcome everybody. This is Fertility Masterclass number 57. And with this masterclass, basically, we have crossed 6.5 lakh views of the masterclass series. So, Shilpa madam, you can take over.
Even I will do the class.
No
Okay.
problem. You can.
Yeah. So, sorry for that. Sir only will be doing the class. So we have covered a wide range of topics in fertility classes so far, and male fertility has been one of our most popular classes which we have covered till now. So there are many variables in the semen parameters that we are starting to look for, apart from the count, motility, and morphology. And the training the laboratory personnel for these parameters in semen analysis is extremely important to improve or optimize our male factor evaluation, basically. So liquefaction is one such a very tiny part of this whole semen analysis, which has not been given much importance. And when we were discussing as to what class we should have today, so Dr. J came up with this topic, which I also found quite interesting to discuss, but I don't know what will be discussed for the next 15 minutes because I could hardly find any literature on this except for a few lines. Yeah, over to you, sir. You can start.
So, I'll be starting with the screen sharing. And Shilpa madam, just see if we can see everything.
Yeah.
Yeah. Okay. So, this is I think, okay, that this is a very important topic as far as masterclass series is concerned, because we are going to be talking about basically semen, which is hyper viscous. Okay, it is this semen which has a very high liquefaction time. Okay, so please understand that basically we are going to be happy when the liquefaction time is going to be anywhere between 20 to 60 minutes. Correct? So, in order to understand this, I think what is important to understand is what exactly happens in the human body. All right. So, I'll just draw the vagina. This is how the female vagina is going to look like. And here is going to be the cervix. So, here you have the posterior fornix and anterior fornix. And during the act of intercourse, it is the male penis which is erect and it is going to go inside. And when there is ejaculation, there is discharge of a coagulum, okay, somewhere close to the posterior fornix. What is important for people to understand is that the pH of the semen which is there is alkaline, okay, but the pH of the vagina, contrast to that, is a acidic pH. All right, fine. Also, it is very, very important to understand that approximately 75 to 80% of this seminal fluid will be then thrown out of the vagina due to the vaginal contractions post intercourse. So let us actually magnify this coagulum and see what is present inside this coagulum. Now, this coagulum, which is actually a coagulum, so the word itself is a very important thing. When it is discharged, it is actually a coagulum. The reason why it is a coagulum, because it has multiple such arranged strands, which keeps the semen held on to each other. And inside these strands, if you look at the microstructure, there will be sperms which are present. These sperms are actually a part of this coagulum because nature wants these sperms to be protected from the acidic medium of the vagina, and there is a binding agent which is secreted. So basically, the semen coagulum contains, when I look at the semen as such, it contains sperms which form less than 2% of the total concentrate. It then contains fluid from the seminal vesicles. It then contains fluid from the prostate vesicles, okay, or basically just the prostate. and it also contains some fluid from the vaginal shaft. Okay, this together forms the seminal fluid. Now, seminal vesicles would contribute to approximately 30 to 45%. Same way, prostate would contribute to around 30 to 40%, and the rest would contribute to around 10 to 20%. Okay, we all know that the fructose is going to come from the seminal vesicles. There is no doubt in that. But what we must understand is this coagulum comes from the prostate. Okay, so this prostate actually contains lot of materials which are antiproteases. Okay, this antiprotease material is important because it allows the sperm to form this coagulation. Then once it goes in the vagina, after being present in the vagina for approximately 10 to 12 minutes, that is the standard time. Okay, it undergoes liquefaction. When it undergoes liquefaction, okay, all these proteins which are holding it to each other will get disintegrated and the sperms will be released. Okay, this initial release of the sperm is very, very vital. And then the sperm will cross the cervix, the sperm will cross the cervical barrier and enter inside the uterus. All right. So, whenever we try and talk of a hyperviscous thing, the most important thing is that there could be some problem as far as the prostate is concerned. Now, remember, if there is a problem in the prostatic proteins, okay, okay, then no matter what you do, hyperviscous semen will remain hyperviscous. Okay, that is important to understand. And this hyperviscous semen will only require mechanical liberation. And after mechanical liberation is done, only after the mechanical liberation, you need to proceed by doing either IUI or IVF for the partners. Okay, that is important to understand. But as we all try and understand that there are many other causes due to which there is hyperviscosity. Okay, but what are the important causes that we should keep in mind of hyperviscosity from an Indian perspective as far as the semen parameters are concerned? So let's look at some practical points. The most important thing is the male partner is going to take the semen in a wide mouth container, and he's going to discharge the semen inside the container, which is going to be sent for evaluation. The commonest problem with this is that it is not equilibrated at 37 degrees Celsius. Okay, as soon as the sample is obtained, it has to be kept on a heating plate or a heating jar, whatever, you know. So it has to be kept on a heated surface, let's just put it that way. And this coagulum will start getting liquefied only if it is at 37 degrees. As a result of which, the commonest problem which is seen in India is home collection. When this guy is collecting the home semen, getting it to the hospital premises, the time is 20 to 30 minutes. By that time, there is abnormal semen liquefaction, as a result of which lot of factors can be altered. As a result of which, it is ideal that the laboratory reaching time should be less than 30 minutes. Okay, to reach the laboratory if there is a home collection, but the most common thing in India is the home collection, which causes an abnormal semen. Second is lack of temperature control. Okay, lack of temperature control, because many times you will see in the laboratory that the jar is lying on one of the shelf. It has not been equilibrated at 37 degrees. Okay, if it is not equilibrated at 37 degrees, there is not enough temperature for these proteins to undergo this type of uh, proteolytic activity, and as a result of which you have an abnormal liquefaction time. Third, very common in India, is infections. But please remember, these infections are usually going to be silent infections. Okay. Otherwise, if there is a frank infection, it's important that you do semen culture plus urine culture. Mandatory. Okay. Also, you must rule out prostatitis. Okay. Remember, prostatitis patients will usually have pain while ejaculation. Okay. So it is not going to be so tough to understand. In infections, the most important thing which people miss out on, which has to be seen, is to rule out melanocystitis, okay, or any infections of the glans penis. Okay, they somehow also contribute to the hyperviscosity of the sperm. A simple course of antibiotics, a simple betadine, A simple good hygiene is going to take off the hyperviscous semen. All right. Fourth, very commonly seen in our country, though it is not, though it is not something which we see all the day in, day out. Okay. But in an Indian situation, it is common that obesity and STDs, sexually transmitted diseases, are also ruled out when you have hyperviscous semen. Now, what is the treatment of a hyperviscous semen? Please understand, or what is a simple way to diagnose a hyperviscous semen? Again, it is a very easy thing to understand. So, when you have this jar, okay, usually from the coagulum, it will form a liquid. Okay, it will form this type of a liquid. So, when you use your dropper, okay, so when you use your dropper, you will be able to aspirate. This dropper is a dropper like this. Okay, we have all seen this multiple times, right? When you see this dropper, you can press here and you can aspirate the whole thing inside, and when you discharge it, it will form drop by drop. Okay, that is the meaning of a liquefied semen sample. Okay, if instead of forming drops, it is forming strands, and these strands are getting longer and longer in length. So the typical length, of course, nobody sits down to measure it, but the simple thing is, if you see strands which are approximately 5 to 10 centimeters, it is a non-liquefied viscous semen. So how do you just cause this hyperviscous to become liquefied? You need to go from non-liquefied to liquefied. So the thing is, you aspirate and re-aspirate. Okay, that is just a mechanical method. Simply you aspirate and re-aspirate by 10 times. Okay, and if that is not functioning, you just take two glass slides, put the sample in between, and I'll just show you how it is to be done. So there is one glass slide. You take the sperm sample here. Okay, you put one more glass slide above this. Okay, and just rub it on each other. Simple. That is another mechanical method, and it will cause lot of proteolysis to occur any which ways. No need to add Islase, it will kill all the sperms. No need to do anything like this. But the sample which you get out of this has to be subjected to an IUI, because what is going to happen is, doing so much of mechanical dilatation really increases the free radicals, and it is going to cause some amount of sperms to die. Okay, so you need to select the best sperms out of this. Go ahead with IUI in hyperviscous semen, and usually in a hyperviscous semen, the results will be excellent. I know people will comment on bromhexine, but I must tell you that bromhexine is something which is a very ineffective drug as far as the Indian scenario is concerned. In fact, there are no major drugs. Some antioxidant therapy can be tried. If at all it works, it works. But there are no major drugs which are available apart from mechanical parameters to take care of a hyperviscous sample. Okay, so with this, I think I've covered a lot of points as far as hyperviscosity of the sperm sample is concerned, and maybe we can answer two or three questions. Yeah, the same thing is with chymotrypsin. Chymotrypsin is not something which is massively effective in a true hyperviscous sample. Okay, not really greatly effective in my
What
opinion.
about vitamin C?
It's just an antioxidant. It may help, it may not help. No proven role.
Okay, so you said it is
But as I
mainly.
said, one may try antioxidants. Trying antioxidants doesn't really, if it is a prosthetic cause, then nothing will work. You will have to do IUI.
Hmm. So, till how long the andrologist will wait for the liquefaction to happen? You said the normal is
45 to 60 minutes is max.
45 to 50 minutes. Yeah, 60 minutes. So,
See,
in
I've
case
seen a
of,
lot of people, when there is a hyperviscous sample, I've seen a lot of people experimenting with hetrazan. Hetrazan is basically a drug which is going to reduce the IgE levels. Okay. If it reduces the IgE levels, people think that the viscosity goes down, but I don't think. We've tried it. It is not something which is so great.
so I mean, apart from antibiotics, you say that there is nothing much and antioxidants which we can try, nothing else.
Most
What's
of the patients who have a truly hyperviscous semen will end up with IUI.
Okay, so is this something which is a temporary thing, or do you think it
More
can
than
get better?
50 to 70% of the times, as I said, it is due to silent infections. And
Hmm.
whenever it is due to silent infections, it will be temporary. After 2 or 3 years, once that infection has settled down and gone off completely, it will become all okay. But usually, what happens is when the male partner presents to you with this type of history, you will have to do something at that point in time. You can probably try to do an antioxidant therapy for 2, 3 months. If there is nothing which is seen, but ultimately these guys will end up with IUI. Trust me.
Mm. So, what is the incidence that you see in your clinic for the liquefaction problem, like raised liquefaction? If you get 10 samples, you think like one will be delayed
We had
liquefaction?
three today, so uh, it's a. I think it's a good volume, maybe around 45 to 50 a month. Because most of these people would end up coming to us just to verify, because I have an excellent video on YouTube on hyperviscous semen for patients on how should they understand it, and I think we get a lot of patients because of that.
Mm-hmm. So, do you think like this hyperviscosity will kind of alter the IVF
No, no,
results?
no,
You don't
not at all.
any other enzymes you have tried like to tease?
Everything is going to cause sperm to get damaged. Better not to try. You want to just try, you try mechanical. Just use needles or glass slides or something, and there is good amount of liquefaction in that.
Mm-hmm. So, in spite of you doing all this, like, the mechanical teasing and all that, have you found that finally the sperms that you get in the end, like they're of poor quality, or
No,
like, uh,
they are
and
good quality.
and does this depend on the expertise of the andrologist who is doing it, or it is just a no-brainer, like anybody can just do it?
I think one has to follow a protocol. So as I said, when we tease, we will either use the dropper 10 times or the slide 10 times, and then we'll immediately mix it with the IVF culture media. And then we will process the semen in the culture media and not in the routine HEPIS, because culture media has a lot of protective factors, especially it has a lot of pyruvate, to be honest, and it has a lot of antioxidants which will help in reducing the free radical stress which is generated out of doing the mechanical teasing. Okay, and that is why using a culture media is a much better option, but apart from this there is no other standardization needed.
Hmm. What is electrosemenography? I mean, have you read about it? I mean, I just like, mm,
Experimental.
okay. Uh, so,
They can probably do it on mice or rat sperms to find out what all that is. No great application in, I mean, practical applications don't exist for all these things.
mhm. So does this hyperviscous cement indicate any other thing? Like, I mean, do you look for anything else in, do you prognosticate
No,
based on the
no,
viscosity of the
no.
cement?
But it
Like,
is a big headache because counseling wise, the males are always told that you have a lot of immotile sperms because you have a hyperviscous semen, and because you have immotile sperms, you will need to do IVF. Where it's exactly the opposite. The minute you do a mechanical vibration and separate all these things off, the IUI samples are absolutely fantastic. And more than 90% of these guys will conceive with IUI, they don't need IVF. The
mhm,
reason why it is reported as immortality is because by the time they examine, most of these sperms have been dead. It's not immortal, they are dead sperms.
mhm. So, how do you place the timer in your the andrology unit? Like you,
Once the sample has been collected and the male partner gets the sample onto the shelf on the pathology lab,
mm,
usually once it comes there after the verification is done and barcode is scanned, it should be on the warmer in the next 2 minutes. And once
mm,
on the warmer, you should start the time. So once on the warmer, it will liquefy in 30-35 minutes.
mm, mm,
Completely liquefy.
mm. Yeah, I suppose so. So have you had to do any like direct testicular sperm aspiration
No,
just hyperviscous?
it's not needed.
Hmm. So 100 out of 100 times, I mean, just with the maximum, like using a dropper or mechanical teasing,
Yeah,
use.
in fact, out of the 100 times you have a hyperviscous sperm sample, 80 will be wrongly reported. So only 20 will remain. This 20 will then, out of this 20 who have not got liquefied after 35-40 minutes, if you do a mechanical liquefaction, out of that 20, 19 will liquefy, you know.
Mm,
So it is not so tough.
mm. Okay, so you think like, I mean, this is just for theory. So the vaginal acidic media is extremely important for the semen to liquefy, or you think?
Once in the vagina, that acidity, optimal acidity, not hyperacidity, that optimal acidity is important to ensure that the proteolytic activity starts.
Mm,
Okay. And I think that is the reason why bacterial vaginosis and probiotics, both these people play a very important role in fertility. You know, both have to be corrected prior to fertility treatments.
so I know you use a lot of probiotics, but what about how do you treat bacterial vaginosis with Metrogyl?
Yeah, I mean, we just take a high vaginal swab for recurrent bacterial vaginosis, which we get, and then you can use the standard therapy. There is no harm in all that.
Mm-hmm. Yeah. So I think it was a good one. So a lot of inputs actually. And one of the good points which you said was like to do both semen culture and urine culture when we evaluate for infections in the male
That is
part
mandatory. Both of them have to have the same bacteria.
bacteria. I think this is one of the I think take home points for today when we are evaluating for the problems.
Actually, semen is very difficult to culture because what happens in you need a liquefied semen sample to culture it. You can't have a hyperviscous semen sample to culture it. So
Mm,
even if you want to culture it, you need to ensure that there is mechanical liquefaction which happens. Honestly,
mm, mm, mm. Yeah, so thank you very much. It was a good one. Thank you for your time. Yeah, I
yeah.
thank everyone who joined today for this interesting session.